a speaker here today was not to follow Joyce, and you see how far. But my wife, Kathy, who's here, is a retired employee, lifetime member of NEA. I have been with you on the picket lines, and I'm going to be with you in the halls of this building. Now, one other little issue that I think needs to be brought into this mix is there are teacher employees, your non-teaching employees in the schools, your state employees, but what is left out, and I'm trying to address this somewhat, is university employees. There are several thousand university employees across the state, and their health care plans are just across the board. Some universities will be paying most, if not all, of the premiums. Some will be paying nothing of the family premium. And yet we have systems that are supposedly to bring efficiency to government, and they're not working. So I have asked the staff to provide me with the information on every institution of higher education and what they are paying and what the employees are paying and what the coverage is. There's also another group out there that we need to keep in our thoughts on this, and that is the other government employees, the municipal employees. About 5 years ago, the city council of the city of Benton came in one night at a city council meeting. It wasn't on the agenda or anything, but they said, we are no longer going to cover retiree health insurance. And they've been doing that for years. Well, luckily they had a collective bargaining agreement that said they would provide retiree health insurance. But what it took was about 4 years of litigation in order to get a federal court to rule you will honor the promises you made to those retirees. So I think we need a broad approach to this, because those city employees, county employees, university employees, teachers, state employees, it all comes out of public funds in this state. And so it needs to be a comprehensive approach to looking at this, and let's put everybody in the same pool so we can get these efficiencies. Now, this is not a new problem. I was born in 1947. That was the year that Harry Truman said we needed national health insurance, and we don't have it yet. Now, there is a lady in your audience here by the name of Candace Collins. She is working with a group called Healthcare for America Now, and she needs your help also. NEA, AEA is part of this coalition in order to get this problem settled at the national level. If they can settle at the national level, then we won't have that problem here. But the purpose of this organization is to see that every American is afforded adequate, comprehensive, universal health insurance. That's our goal. And so if you have a chance to have Candace come to your group to explain, we're trying to get our U.S. senators and U.S. congressmen on board with this concept. Barack Obama, President Obama, has supported this concept and has signed on to it, and we need to make sure that our federal delegation also signs on to it. Congressman Ross has already signed on it. Congressman Berry has signed on. We need to work with our senators and our doctor Congressman Vic Snyder. So whatever help you can give Candace. And I would ask Candace to raise her hand, but I still don't know if you can see her or not. Everybody's raising their hand pointing down. But anyway, like I said, I've been with you before. My wife is a lifetime member. We have been close to this organization. We will continue to be close to it. So whatever help I can do, I will provide whatever help I can. Thank you very much.
Thank you, Representative Nichols.